like New York, Louisiana, and other places. So, but I think the surge is coming for Texas, and that's why I think this is a great opportunity to learn about what we can do to mitigate this surge and minimize the number of hospital admissions and deaths.
Um, if you also can talk about, the testing that's happening in Collin County, where exactly, people can go and have the test done if they don't already know about it.
So this is a fluid situation right now, and you can obviously, if you read the news, there is a shortage of tests everywhere. There are federal tests that are available through the government, through the Collin County Health Department, and then there are some available from private labs like LabCorp and Quest. But there is a shortage of tests everywhere right now on the ground, no matter what anybody says. And the problem with that is we only test patients who are severely ill with symptoms requiring hospital admissions. As of now, we are not testing the general public with mild symptoms. Most of the emergency rooms are doing the same thing to preserve the testing that is available to us right now. The most standard and accurate test that is available is the polymerase chain reaction test, which is basically magnifying the genome of the virus that we're looking at. And that test is available almost exclusively everywhere. We're not doing any other antibody testing right now. PCR test, which is a polymerase chain reaction, is a very specific and sensitive test. It will hopefully have us include patients that need to be treated or hospitalized. And the ones who are negative, the test has been very, very good about. I didn't have to repeat any tests on patients who had negative testing to see if the test was falsely negative.
Okay. I mean, I'm going to go straight into the questions now because I think there are a lot of questions coming through. Let me just go through the questions I have on symptoms. From Miss Mayfield, I have asthma. Do I need to take more precautions despite being 40? Also, what would my plan of action be if I became symptomatic?
Yeah, so asthma is one of the high-risk conditions. Any underlying lung condition, asthma, COPD, would be at risk for getting complications from COVID-19 infection. But if it's a controlled asthma somebody has, I don't think you need to do anything different. I think you need to watch for your symptoms. If you get any worsening shortness of breath, if you get any worsening cough or fevers, those are the symptoms you need to look for. And if that does happen, then you need to seek medical attention right away. And as far as steroids, short courses of steroids that you do get for asthma exacerbations are okay. They're not contraindicated in this scenario. Whatever your doctor or lung doctor decides to treat you with is completely fine. You don't have to change your treatment pattern.
That answers your question, Mayfield. Thanks for the question. Another one, I think I have a lot of anonymous, so I'm going to just read the questions. 2 young people with no underlying condition getting the virus, but behaving very differently. Do you know why?
Well, that's a question we probably don't have an answer for right now. What happens is we're seeing majority of cases are between the age of 20 to 60 right now, if you look at the maps anywhere in the country. So the younger people who do not have any underlying medical conditions, we don't know the exact pathogenesis, what happens, what makes them super sick. But I can tell you this anecdotally from the people that I've read about who have gotten sick. It also may depend on the degree of exposure to the virus. So if you're in a hot zone, for example, New York, where you're seeing a lot of young people, young doctors, even non-doctors get affected and get severely sick, the degree of infection depends on how much you're exposed to. So if there's multiple people who are exposed to the virus, if the person exposed to the virus from multiple people, then you're at high risk for getting more number of the virus in your nasopharynx, and that's more likely to cause severe disease. Severe disease is directly proportional to the amount of virus in your nose and in your nasopharynx area right there. So I think that may be the cause, but we don't know for sure right now what other factors may be responsible for young people getting sick and showing different symptoms.
Perfect. Thank you. Couple questions on hygiene we have here is most hand soaps claiming to be antibacterial are sold out, but this is a virus. So is any soap sufficient or any antibacterial better?
Yeah, so I don't think the antibacterial soap or non-antibacterial soap matters. As long as you wash your hands in the correct way for 20 seconds or more with soap and water, you should be able to stay safe. And if you don't have access to soap, you can use alcohol sanitizer, which has 60% of alcohol or more to get the same effect. But remember, after you, so most importantly, you need to do this before you eat. If you cough or sneeze, or if you are touching any surfaces, you need to wash your hands after that.
Thank you. On that topic, once we are back to normality, in an effort to keep our home, car clean, should we focus on cleaning, disinfecting, or sanitizing as a habit? That's very general, but
it's not going to hurt. I think sanitizing is not going to hurt, especially the high touch surfaces. For example, doorknobs, kitchen counters, bathroom counters, things that you touch on a daily basis. Toothbrush handles, stuff like that in your car, steering wheel. All those things you almost take for granted. Your phone, those are the things you need to hopefully get into the habit of making sure they are clean and you wipe them often to prevent the spread of germs. And this is just one of those germs which is highly contagious, but there's other germs that can also live on these surfaces. So I think it's a good idea.
I have a good question from Jeffrey Swan here. Why does Dr. Duggal believe the surge is coming to Collin County? What specifically is different about Collin County, which would make the surge come later than other areas?
So if you look at I'm sure if you look at the explanation of virus multiplication models in all parts of the country, these are computer-based models. Mm-hmm. And, if you look at New York, what's happening in New York right now, it's almost up to the peak of the curve. If you look at the curve, the curve goes up and then it goes down. Mm-hmm. So New York is getting almost to the peak, and in the next few days, it's going to get to the peak. So think of each state in the country as a different zone, which is at a different rate at which it climbs up and then goes down, okay? So because of that, New York is obviously the highest and the hardest hit state, but other states that have low numbers right now, including Texas, as compared to New York, we are going to see a lot more surge in cases in the states like that. For example, you look at Louisiana, they were nowhere on the map and boom, their cases surged up. So this will probably happen in other states as well. And from what I'm hearing about Texas in general and Collin County, because we live here, there is going to be a surge coming. The prediction is in the next 2 weeks or so. So that's why, you hear on the news as well that, they're talking about preparing for the worst 2 weeks in the stretch of coronavirus infection in the US with so many deaths and hospitalizations. A lot of hospitals will get overwhelmed. So I'm just trying to prepare everybody for this. So we are on top of what we need to do to prevent the spread of the viruses by social distancing, hand washing, and everything else that we can do.
Cool. Also, can you please discuss inpatient treatment modalities? This is from Sarah Gomez. Thank you for the question.
Yes. So obviously treatment is a big topic right now. You must have heard on the news as well about various drugs available to treat and investigational therapies available based on the limited studies that we have. And if you hear Dr. Fauci from the NIH, they talk about this in detail as well in their briefings. From what I gathered, from what I've read and looked at these studies as well, the effect of hydroxychloroquine, which is the anti-malarial drug, anti-rheumatic disease drug. It's promising. There was a study in France which was done, low number of patients, but they had seen a significant decrease in the virus in the nasopharynx part. They looked at the nasopharynx every day and decrease in the number of the virus particles as compared to non-treated patients. And then they also had another arm where they combined that with azithromycin, the drug Z-Pak drug. And in those cases, there was 100% reduction of the virus on day 6. So again, these are small studies which have been done in different places, China, South Korea. In South Korean studies, they used zinc in combination with hydroxychloroquine, but the common denominator was hydroxychloroquine. I know this is not perfect. I know this is not, slam dunk the treatment, but if someone came to me and asked me if someone was admitted to the hospital and they were getting sick, they had some respiratory symptoms and they were requiring a lot of oxygen and they were running fevers, I would definitely put them on a combination of hydroxychloroquine and azithromycin. And I've been adding zinc to their treatment regimens because of the, again, the anti-inflammatory effect. And also zinc has been known to kill other viruses as well in vitro, which means outside of the body. So we are extrapolating that and using that in patients. So one treatment is this, and then there's the investigational therapies. For example, there's this drug called remdesivir, which is available from the manufacturer on a compassionate basis on severely sick patients, and there's criteria for that. And then there's another drug, which is IV, which is called interleukin-6 inhibitor. I'm not going to confuse people, but basically it's a drug which decreases the inflammatory surge in the body from this infection, and it's useful in very, very sick patients. And the last therapy, which is not the least, is the plasma therapy, where you take the plasma from a patient who was infected with coronavirus and they have recovered. They use their antibodies or the proteins in their blood to infuse into a patient who is severely sick. And that is shown to benefit some critically ill patients in limited studies, but there's a lot of hope that this may be helpful in people who are extremely sick. And there's studies going on, and FDA is accepting patients who want to donate plasma who have been affected by coronavirus, and they can donate their plasma to the FDA as well.
Guys, I think a lot of people are raising their hands, but I'll hand over the microphone at the end of the session. But we have a lot of questions to go through here. So let me first take care of these questions, and I'm definitely going to give the microphone to you guys at the end of the session. So please be patient. Thank you for the questions here. So this question is from, the next question is from, let me take this one. So Annie Johnson, I think she knows you from Ohio. Is there anything?
Yes.
Is there anything different to watch for infants? Any additional precautions to take? I'm working on a COVID and have a 4-month-old at home. Thank you, COVID floor.
Hi, Annie. Hope you're staying safe as well. Yeah, I think there is almost no, I should say no, but very, very, very limited spread of coronavirus infection in infants and young children. If you go on the CDC's website, there's very limited number of cases that have been described. So do all the precautions that you would in a patient who is a PUI or a confirmed. PUI means person under investigation or a confirmed COVID patient. So you do your, your N95 mask or surgical mask in the hospital. You wash your hands, do everything that you would do anyways. And then when you come home, you get rid of your scrubs, you put them in the wash, you take a shower, make sure you wash your hands and don't touch your face or your nose or anywhere else. If you cough or sneeze, use use tissue paper and throw it away right away. So just those common sense things, which as a nurse, I would do exactly that. And, you should be fine. And congratulations on the baby as well.
A lot of questions on the masks here. So most of them are related to, do we need to wear a mask when you go out for jogging or walking or, through maintaining a social distancing as well in general? Should we all be wearing masks irrespective of the situation? once they step out of the house?
So this is also a evolving situation. CDC did update their guidelines now, and they do recommend people who go out into grocery stores or pharmacies to wear, you know, some sort of face covering. They don't want people to wear medical grade face masks, you know, the surgical masks or the N95 masks, because they are in very short supply, as you see everywhere. So if you can become creative and you can use a bandana or something else, you know, a scarf to make a mask, or you can make it at home, which has multiple layers. Basically, you're trying to avoid spreading coronavirus to others, because you can spread coronavirus infection in an asymptomatic or pre-symptomatic phase. And that's what the CDC is trying to stay ahead of, is advise people to wear this, especially when you go into a indoor setting. So when you go outdoors for a run or a jog, I don't think you need to wear a mask, especially if you're you know, passing, and if you're maintaining your 6 feet distance. Remember, the key is, even if you're wearing a mask in public at a grocery store or a pharmacy, make sure you still do what you were doing otherwise, is you know, maintaining your 6 feet distance, and also using hand hygiene whenever appropriate. If you have access to gloves, you can wear those as well, which would be good, because then you can just get rid of those gloves when you come out of the grocery store. So do those things, and you know, protect others by wearing these masks, because you could be carrying the virus and not be having any symptoms.
Perfect. And this question is from Tiffany. She seems like she's from Ohio as well. Go Browns.
Go Browns.
I'm currently 6 months pregnant with my first child, with limited knowledge of effects. Are there specific precautions pregnant women should follow? Great question.
Great question. Congratulations, Tiffany. There is no data on COVID infection in pregnancy right now. It's still, you know, still evolving, as you know. But pregnancy is considered high risk state. If you look at influenza and other infections that we talk about in pregnancy, we do say that it can cause severe infection in pregnancy because of the change in the metabolism and what's going on in your body during pregnancy. So I would suggest take extra precautions that you are anyways. You know, be careful when you go in and work in the hospital. You know, if you are in a patient care unit, then make sure you wash your hands. And if you are, again, seeing PUIs or confirmed COVID patients, you do what's required to be done. But if you have any semblance of symptoms, you seek medical attention right away, because you know, you don't want to dismiss those symptoms. I think you can be extra careful, especially in the state that you're in. And go Browns.
A few questions on the food related stuff. You know, is this virus foodborne, or can we go out and eat food, or take out or delivery? You know, what do you suggest on those food?
So up till now, there is no food or waterborne transmission of the virus, as long as the food is well cooked and you are either having it delivered to your house. So the suggestion would be to whoever delivers the food to the house, you know, take precautions, you know, keep the bag or throw the bag away that comes with the food, and you can sanitize the containers that the food comes in, and then you can consume the food. It should be okay. There should not be any restriction on that. Even if you're picking it up from a drive-through, you follow the same precautions. Obviously, most of the eat-in places are closed right now, so there's no question about that, because they don't want to have multiple people in a small setting in a restaurant. So takeout and delivery is okay. Cardboard boxes that come in with pizza and everything, you have to be careful, because the virus can stay on those cardboard boxes for almost 24 hours. So my suggestion would be to get rid of those cardboard boxes and, you know, transfer the pizza into, you know, something in home, a big plate or something, and then consume it that way, so you're not exposed to the virus.
You know, I have the same question. Just want to ask you on that one. I think nowadays people are pretty much ordering everything through online, right? We have Amazon delivering those boxes, and even the mail. Obviously, you want to take it. Is it okay to, you know, bring the boxes in, take out your stuff, and then throw the boxes out. You have to keep it outside for 24 hours. What type of measures people are suggesting in terms of doctors suggesting these days?
So my suggestion would be to, if you can, empty from the box from outside and empty into a container that you use in your house. That would be better, because that way you minimize hands touching that box. And if you do touch the box with bare hands, make sure you wash with soap and water before you eat or before you touch anything else. That's the way to prevent the virus from coming into your house and staying at different surfaces. And that way you prevent others from getting affected and you from getting affected, and you may be asymptomatic as well. So that's the key. You may not have symptoms and you may be carrying the virus. So we want to prevent that as much as possible. So any precaution you can take. If you get a box from Amazon, you take whatever is in the box outside of your house, dispose of the box in the garage in your trash container, and bring whatever the goods that you ordered in. And then make sure you wipe everything as well, because if they're packaged in plastic is another surface that the virus can stick around for almost 72 hours. So you have to be careful about plastic as well.
About the mail, people can get the mail and then just open it, or you suggest them to open the mail outside as well?
I think if you have a designated area in your house where you open mail, for example, a counter where you put the mail on, you could bring the mail in. And, after you are done sorting through the mail, you dispose off whatever you don't need. And, after you're done with everything else, as long as there's no packages or envelopes left, I think you should be safe, because everything in the mail should be okay because it was in an envelope. And you wash your hands with soap and water after that as well.
Why can't I get tested for COVID-19 so I know I have it or not?
Oh, that's a great question. In a country like ours, I wish that was possible. That is the best case scenario. If you look at what South Korea did, is they made the testing available to almost everybody that was even mildly symptomatic. So what happened is, because of that, they were able to identify people who had the infection, and they were able to quarantine those people and do contact tracing. That way they were able to minimize the effect of the virus right away. But unfortunately, for whatever reasons, we do not have that available in our country. We do not have the capacity to test you if you want to get tested. There is no way that's happening right now. I would say this probably would not happen in the next month. The way things are going, we are short of tests everywhere. I don't think that's happening unless you have symptoms, and if you have severe symptoms, that's when you can get tested. Otherwise, even if you go to the emergency room, they might tell you doing a test will probably not gonna change what we're gonna do. You go home and stay in quarantine for 14 days. And I wish there was a better answer to this, but that's the reality of the situation right now.
Okay. FDA has approved the antibody test. How reliable is the test? It's from Chately.
So the antibody testing has been approved, but the antibody testing is only done to see if you have been exposed. Let me go back. So the testing is only done on people who have confirmed previous diagnosis of COVID-19. And the reason for doing the antibody testing is to see if you would like to donate plasma for the program that I mentioned before, where you would be able to help others who are severely sick. Antibody testing in general would not help us in an acute pandemic setting, because the antibody will not give us an idea. If you have an acute antibody, it doesn't tell us when you were affected. So, if you were not in quarantine, do you need to be in quarantine? So instead of the antibody testing, the better test is the PCR test, which I mentioned, which is a much more sensitive test, and it picks up active infection right now. So then we take measures that we need to, and we do the 14-day quarantine, and make sure your contacts that you were with also have the same quarantine, and that way we prevent the spread of the virus.
Thank you. This question is from Erica, and she says, is this airborne or droplet? Such mixed information and rapidly changing information. What are your thoughts on that?
Very good question. So right now, it's considered droplet. and droplet means it could be small droplets or larger droplets. So the small droplets are the droplets that happen if I'm talking to you or anybody in person within 2 feet, and you don't see anything in the air. But when you're speaking, those droplets are coming out of my mouth, and they could affect somebody within 2 feet distance. And the larger droplets are the ones that happen when you sneeze or if you cough. So they can travel up to 6 feet. That's why there's a 6 feet general guideline for 6 feet distance when you're in public places. Um, if you look at the hospitals, most of the hospitals, they do not have these patients, the PUI patients, the person under investigation in airborne isolation. Most of them are in enhanced droplet and contact isolation, which basically means you don't have negative pressure rooms for these patients. You just have regular rooms, and you restrict entry. And if you do enter, you need to have the proper PPE that you put on before you see these patients. So right now it's not airborne, it is considered droplet.
Another question from Anonymous here. This is regarding the spreading. So what do we know about the mutation of this virus and how this mutation going to react in the fall? Is the strain weakening or strengthening so far?
So if you listen to the experts on this, Dr. Fauci specifically, he has mentioned this before as well, that the virus that we're dealing with, the novel coronavirus, is not some virus that has been known to mutate. This is the first time that has happened, and he expects that once you have the infection with this virus or you're exposed to it, you should not have to have another infection in the future. You should have lifelong immunity against the virus. Excuse me. So the mutation part, excuse me. Mutation part is obviously, it's likely not going to mutate. That's the prediction. It's not like the influenza virus, which mutates almost every year because it changes its structure very quickly. Coronavirus in general is not known to be a virus that mutates frequently, and this is the first time occurrence that was seen. What caused the occurrence, we do not know. It's usually in animal reservoirs or animals who carry it, but it was transmitted to humans, and from there now we've seen human to human spread as well, obviously. So that's what we need to prevent.
Thank you. The next one on the trials here. What can you tell us about the blood transfusion therapy trial? If it's approved, how easy is this going to be available to the general public? Do you know anything about it?
So I think we talked a little bit about this before. Basically, what we're talking about is plasma infusion from people who have recovered from the infection into people who are extremely sick with multiple organs failing in the ICU on the ventilator. Those are the patients that would benefit from this infusion, which basically provides immunity against, or provides antibodies against fighting the virus when people are acutely ill. So these have been shown to decrease the disease severity, improve oxygenation in those patients on the ventilator, and hopefully improve in mortality as well. But these studies are very limited. FDA has approved this for severely sick patients, as I mentioned. This is not available for the general public right now. You will have to, we have to jump through hoops to get this drug for patients who we need to. I don't think it's going to be available for the general public in the near future.
The question in everybody's mind: when do you expect the things to get back to normal, get back to work, schools, travel, etc.?
Oh, I wish I could answer that.
Sure.
I don't have a clear-cut date in mind, and the reason why I say that is when I mentioned the curves in different states are in different trajectories right now, and you can't predict. Even if New York calms down, you can't predict what other states will do that are low right now. And if there's transmission from a state to a different state, you could have chances where you could see many peaks in the virus pandemic as well in those states as well. So it's very, very complicated to say when we would be able to get back to a normal life, when we don't have to do social distancing, when these sporting events will occur, or when we will be able to go back to the restaurants and movie theaters and all that. It's very difficult to predict that right now. But if you look at the general, again, the general curve, and from what the computer predictions are, I would say nothing before at least middle of July. That's what I'm looking at right now from what I've read. But again, things can change. Um, China, the way China was able to curtail its infection rate and what's happening with Italy and Spain right now, I think we're behind them. But if we are able to control the spread of the virus much faster by doing what Dr. Fauci always advises us to do is practice hand hygiene, social distancing, staying at home. Staying at home is the most important thing you can do unless you are an essential worker to prevent the spread of the virus.
Right. Okay. This question is it's okay. What resources would you suggest to look at to see where an area or state in regard to peaks, surges, for example, in this case, Ohio, right? Person from Ohio is calling you.
You know, I don't know if there's specific resources that you would be able to look at, but I know the governor of Ohio, Mike DeWine, has done an excellent job in staying ahead of almost all other states as far as shutting down schools, staying at home order and all that stuff. So they provide updates in different states, especially in Ohio. I think they're doing daily updates on what they see is coming. I know there's been a big surge of cases in Ohio as well, especially healthcare workers as well. And I know, being from Northeast Ohio, there's a slew of hospitals and healthcare systems there. So, I don't know what other resources I would suggest to look for trends, but I would definitely listen to the Ohio Department of Health, the governor's office, and look at the prediction models from our own Cleveland Clinic, which has been excellent in staying ahead of research as well, and telling people what is coming up.
I think this regarding how to make your immune system strong to fight this virus. Any suggestions or anything that you suggest in terms of taking food or anything that will make the immune system strong?
Yeah, I don't think there's any home remedies or foods that I would say would make you immune to coronavirus. Okay, but if you look at common sense things, a well-balanced diet, adequate sleep, less anxiety, try to stay off of social media and constant 24/7 barrage of disinformation making you anxious. All those things play a role in your immunity. Okay, so the most important thing you can do is eat a regular healthy diet. Try to get some exercise if you're home. Try to walk around. Make a routine. Get some sleep. Try to stay away from this news cycle 24/7, and rely on the experts on getting news and information that you need. You do not need incorrect information getting into your head and then you start worrying about it. I would rely on the CDC. I would rely on Dr. Fauci, Dr. Birx. Those are the people I would listen to for getting accurate information of what's going on.
All right, so I'm going to open up the microphone to you people who want to ask questions. Raise your hand, guys, and I'm going to just unmute you guys over here. Does anyone have questions? That was Sandeep who had a question.
Hello?
Sandeep?
No, I think thanks, Anurag, Sandeep here. It's great information. I think everyone was getting all the information from all the sources, but thanks for arranging. I think my question is answered, Ramesh. Probably was on mask and other things, how we want to do it. But I think it's a great initiative from the Startup Grind and Anurag. Thanks a lot.
Yeah, you're welcome, Sandeep. Let me add one more thing about the masks.
Go ahead. Go ahead.
Now I'm unmuted. So masks are also available dime a dozen everywhere if you are getting masks. So please be careful about the mask. There are certain masks that are able to, basically what I told you is if you wear a mask, you're trying to prevent the spread from you to someone else. And if everybody does that in one way or the other, you basically are trying to avoid affecting others when you're not symptomatic. So Masks are not the end all be all. Remember that. That's what I want to drive home. You still have to maintain social distancing. You still have to stay home as much as possible. Designate one person in your family who gets groceries. Go out as minimum as possible. Do what you need to do to stay home as much as possible. That's the bottom line. So as long as we comply with that, we should be able to cut down the spread of the virus. And the reason why I say that specifically in DFW area, in Frisco, Plano area, is because of the fact that we haven't seen too many cases yet, but we do expect the cases to go up, and we can make an impact on that by doing what we need to do.
I have Vinod who wants to ask a question. Vinod, I'm unmuting you. Go ahead. Vinod.
Hi, good evening. Thank you for arranging this session. A lot of information. One question: does this hot temperatures restrict the spread of virus? I mean, if temperature increase in temperature does help us.
Yeah, so there is no data right now to show if the temperature makes any difference for coronavirus specifically. But if you look at the general, virology and viruses in general, for example, influenza and other viruses, they tend to decrease in number in the hot months, in the summer months, because the virus is not able to survive in that temperature. But right now our temperature in at least in Texas and DFW is not conducive that we can say that it's over 100 consistently, that we don't expect the virus to stay on surfaces, that we should be okay. So I still think we need to do everything we're doing. The virus does like hot and humid temperatures, but we've seen, we've seen cases in Singapore recently that went up, and Singapore is hot and humid. I don't know what the average temperature is over there, but I would not rely on that at all right now to guide us as far as what we need to do.
Thank you, that helps.
No problem.
Anyone else? Raise your hand and I'm gonna let you in here. Okay, that's one. Okay, that's what we've done. What is next? Anyone? I'm gonna go back to my questions. Okay. Any information if this can resurface after some time?
What was that, Ramesh?
It says any information if this can resurface after some time, like, it's going to come back again, or any information on it?
Yes, it's possible that if we hit a plateau in the curve, if the curve was going up and if we are able to plateau it down like this, at some point, you may see a spike of the cases again in the future. So, I don't think we should sit back and say, once we're done with this, that we're done with this, because you could still see more cases or more mini spikes of this. Hopefully we would have learned better and we would have had a cure as well. Hopefully that has been studied. We are in the process of studying these drugs that I talked about earlier to see if they could benefit and which drug would be more beneficial than the others. There are more drugs being looked at as well, which I haven't mentioned about. Also, the vaccine that already is being touted, but it will take about 12 to 18 months for the vaccine to be available. So I would not count on the vaccine to be able to protect us as public and in general. But I would do everything we're doing right now. It comes back to the same thing I keep saying again and again: social distancing, staying at home. That's the most important way we can prevent the virus from spreading around. That's the most important thing we can do.
Fantastic. So I think in the interest of time, we have another 7 minutes here. So, everyone for a few minutes and see if you have any questions. If it gets too chaotic, then I'm going to mute you all. And you can raise a hand on Zoom, and then let me unmute you all for a few minutes. Okay. Ask you questions.
I'll get your
It's not going to work because it's too chaotic over there. So I think we're still having some more questions coming in. So let me ask you this one. Here it says, that's a big question, but I'm just going to ask. My doctor said I have COVID-19, but would not order a test for me. Why? Since I don't have any underlying health conditions like emphysema, heart disease, and diabetes.
Yeah, so that's the typical scenario I was talking about, that if your doctor told you that you have COVID-19 infection, you had some symptoms that were suggestive at the time when your doctor talked to you, but you were not sick enough to go into the hospital. So that's the reason they did not order the test, because the test availability, the number of tests that are available is very limited right now. So that's the reason they didn't test you. And, you know, it hurts me to say that, but, you know, in a country like ours, we should not have to face this problem. We should have the test available for the general public to be tested, specifically if you have symptoms, even if you have mild symptoms. But, you know, we don't have a say on that. What we do have a say on is being rational and doing testing on people who need to be tested. Let me tell you one other thing about the new 15-minute test that has come out with Abbott Labs. That is a point of care test that is available. They're sending out 50,000 per day to different hospital systems. And we have access to some of those in the hospital, but those are only reserved for patients who we highly suspect for them to have the infection, and we need to make a plan on their treatment if we need to put them on drugs that would be required for COVID-19 infection, or discharge them home if we think that, you know, they are stable enough. Because some hospitals, I'm seeing this backlog of the test turnaround time is 7 to 10 days, which is very, very hard for us as physicians in the hospital to, you know, to make plans on what we need to do about these patients. So the 15-minute test that I'm talking about is a very, very good molecular test that has come out, and you know, we get the positive or negative result within 15 minutes. And that's excellent. If we can somehow get this test available more, it will change the way we are managing COVID-19 right now. Also, there's been an initiative for people to do self-swabbing, because, you know, I think they are trying to protect the personal protective equipment for these testing centers. If you do drive-in testing and whatnot, they are trying to minimize these PPEs that are being used everywhere. But I think the problem with that could be the way you test yourself, because if you have ever been tested for this kind of test, they put the swab all the way to the back of your nose, and it can be painful sometimes. And that is the right way to collect the specimen. And I'm not sure if anybody would do that intentionally at home. When you're sitting around, you may just swab at the tip of your nose and give the test back to them. So you may see some false negatives. So I think we need to work on that and try to see if we can ensure proper technique of those tests as well. But those are not available right now. They will be coming. And hopefully, you know, as we get more and more testing available to everybody, we should be able to definitively say who has the infection and who does not. And the people who have it can stay at home in quarantine for 14 days. And that may be hopefully able to control the spread as well.
Are those tests coming to, you know, when they're coming to Dallas areas?
The Abbott test is available right now at one of the hospitals I go to. They're available, but they're very limited tests available per day. So we are only reserving that for patients who we think would need them.
So Anurag, we're getting a lot more questions. Would you be okay if you stay on for another 15 minutes?
I'm happy to stay on for another half an hour.
Thank you so much. I appreciate it. So is it true that people with pulmonary disease are more susceptible to COVID-19?
Yes. So if you look at patients who have chronic pulmonary disease or emphysema, their lungs are compromised because their lungs have structural changes in the lungs, which would make it hard for them to get rid of an infection if they get the infection in those lungs. And that's why, you know, those are the patients who may suffer complications from COVID-19 infection. And those are the ones that we need to watch closely and make sure we catch these infections quickly in those patients and treat them right away instead of waiting for them to get worse, because then it's a cycle that we would not be able to stop. And that's why asthma, chronic lung disease, emphysema patients who have interstitial lung disease, they take immune suppressive medications and stuff like that. They are the ones who are more likely to get severe infections in general, not just COVID, but also other viral infections. We see that.
Any special instructions if you have a pet?
Up till now, there has been no transmission in pets. Although I should say I saw a report today that there's this tiger who got affected in the Bronx Zoo from a worker who worked there. But again, this is a one instance that we've seen. But up till now, we have not seen any transmission through pets. So, but if you are somebody who has the COVID-19 confirmed infection, I would say in general avoid touching your pets or having them lick you or do everything that you would do otherwise, because again, you don't want to someone else to touch the pet, or the pet touches something else that you're around. And although right now they're saying there's no fur transmission or from the pet skin, nothing like that happens. But I would be extra careful in those cases anyways. Use common sense and avoid exposure to pets if you are infected. If you're not, you should be okay.
Question from Steve and Rachel. So they want to ask your question. So Steve and Rachel, I'm going to unmute you. Go ahead and ask your question, please. Steve?
I think he's still muted.
No, he's on.
You there?
Yeah.
Yeah. Hey, Steve.
How are you? We miss
Good,
you
how
up
are you?
here, my old neighbor.
Thank you. Thank you. I
So-
miss you too, man. Thank you for your work. Thank you for your service.
Well, thank you for yours. So is there a too soon to test time frame? And is the onset of symptoms 2 to 14 days from exposure?
Yes. So the onset of symptoms in general is 2 to 14 days. That's why they recommend the 14-day quarantine for people if they have traveled to areas which are affected, or if you have been exposed to somebody who was affected. Although there are some case reports where the onset of symptoms can go up to 19 days or 20 days, but those are rare. So I'd say in general, it's 2 to 14 days.
Okay. All right. Yeah. Thank you. Because Stacy's on a COVID floor at Mercy Hospital, so we're a little bit concerned about her, obviously.
Yes. Yes. I remember. I think 2 to 14 days should be a good period where you can stay in quarantine. And again, there's guidelines which the CDC has on their website about when can people come off of the quarantine. Okay. So there's two ways to do it. One is a test-based method, and the other one is a non-test-based method. But I would not recommend the test-based method because the tests are not available anyways. So I don't know how we can test somebody to say, oh, you're negative, now you can go back to the general public. So the non-test-based method is that if you've had 7 days from the onset of your symptoms, last symptom that you had, the fever that you had, and if you had 7 days from that, plus 72 hours of resolution of any other associated symptoms of cough, shortness of breath, anything else. So if you count that, it comes out to be 10 to 14 days from the time you were exposed, or the 10 to 14 days from the time that you had symptoms, the last symptom that you had. So I would still think ballpark 2 weeks would be safe for you after your last symptom, that you can say, okay, I don't need to be quarantined anymore. I can do my job or do whatever I need to do.
Awesome. Thanks. Go Browns.
You're welcome. Go Browns.
Thank you. All right, so I have questions on the vaccines, ibuprofen, Advil, Tylenol. So a lot of mixed questions on here. So I'm just gonna kind of rephrase them in a way, maybe the best I can. So we heard about avoiding Advil, ibuprofen with COVID. Any truth to that? Another question followed by that is, do you recommend only Tylenol for fever? No ibuprofen if I had one of the symptoms? So if you can take a dig at it.
Yeah, so there were some anecdotal reports of people who were taking Advil who got worse when they had the COVID-19 infection. but those were anecdotal reports. And if you look at the data that is coming out now, there is no contraindication to the non-steroidal anti-inflammatory drugs, Advil, Motrin, Celebrex, those kind of drugs. You should be able to take them even if you do have the infection. Tylenol is also another alternative. So you can choose whichever one you want to. If you have other problems that would require anti-inflammatory drugs, for example, if you have arthritis and stuff that you take the drugs for, I would take the drugs. I would not stop them. But if you don't have any other reason to, then maybe take Tylenol if you want to. But there is no data to show that you should not take non-steroidal anti-inflammatories.
All right, so it's a question from Anonymous here. I'm not sure. The data from China suggests that the virus lives on in median in up to 37 days. Why is quarantine period only for 14 days? I don't know.
Can you repeat that? I think you cut off for a second.
Sorry, it says that the data from China suggests that a virus can live up to 20 to 37 days. Why are we doing only for 14 days? I'm not quite sure the data is getting the data from, but it's a question that the gentleman had.
Yeah, I don't know about the 22 to 37 days. I think that's a stretch. The most I've seen in surfaces that I've looked at in different surfaces, again, this has not even been reported or studied as much, but from what I've seen is plastic has the highest number of hours that it can stay on, almost 72 hours. And then, you have cardboard boxes, which are high risk as well. But other surfaces such as wood or granite and stuff like that should be okay. I think that 14 days should be a good enough time, especially if you're able to sanitize things that you touch on a regular basis with either chlorine-containing products or the Lysol wipes that you use at home. Any sort of disinfectant wipes should be able to get rid of the virus from surfaces that you touch on a regular basis. So follow common sense, and if you do that while you are staying at home, you should not have any risk.
Perfect. Some questions on the immune here. It says that, you spoke about immune suppressants, but will ACE inhibitors and ARBs also enhance the impact of COVID-19?
So this was another uproar about using people who have been on ACE inhibitors and ARBs, which basically are used for blood pressure. And this virus, the coronavirus, apparently attaches to the receptor that the ACE inhibitor attaches to. So that's why there was a concern that if you're taking ACE inhibitors, you are at high risk for getting complications from the virus, specifically in the lungs. But this has not been shown to be true. If people are taking ACE inhibitors or angiotensin receptor blockers, the ARBs, you should be able to continue taking them for your blood pressure. This should not be a contraindication. And what they talked about is sometimes the way they described is that this virus affects this substance in your lungs called a surfactant. If in layman's term, you think of the surfactant as a soap that if you have a sponge in your kitchen and you soak it with the soap, it becomes soft. That's the role of the surfactant. And with this viral infection, the surfactant number or the quantity goes less, and that's why your lungs become kind of rigid, just like dry. I'm blanking out on the name. So basically, the lungs don't have as much capacity to work as they are supposed to work, and that's when the virus kicks in and then causes this damage to your lungs, which can cause people to get on the ventilator.
Understood. Couple of questions on high blood pressure linked to coronavirus. What's the link there?
So if you look at the CDC website, high blood pressure is not mentioned in the high-risk conditions. Most common high-risk conditions are, people who have chronic lung disease, people who are diabetics, people who have any kind of immune suppression because of, they're on medications to decrease their immune system. Those are the people highest at risk. But anecdotally, there has been data reported on high blood pressure patients that has shown that these patients get severe infection as compared to people who are not high blood pressure patients. Again, data is very limited right now. I would not think that would be super high risk, but again, you can never be extra careful. We are getting more and more information. This is relatively new for us right now. We don't have enough data on a lot of these risk factors and the pathogenesis of the virus, but we are trying to gather as much as we can and make sure, you know, we educate the public about that.
Fantastic. I think one question on the vaccines again. Any reports or did we discuss about the effects of BCG vaccine most South Asians have as kids? Can you talk about it?
Yes. So, you know, I saw this as well. And, you know, there's a immunologist in India who had looked at the effect of BCG vaccine in enhancing your immunity in general. And the same thing was studied in Germany. There's this institute where they're looking at a derivative of BCG and giving it to people who haven't had it before to see if that would help decrease the severity of the coronavirus infection. It would not prevent you from getting the coronavirus infection, but it would hopefully help in decreasing the severity of the infection. So again, this is relatively new. There's more data that's needed, but I have read about that. And you know, people in India get the BCG vaccine when they're born. So we'll see, you know, if rates in India are different from others. But again, there's a lot of other confounding factors as well.
All right, so I think I'll just keep it one more question here. This is regarding the masks again. There's a shortage of masks everywhere. Like a lot of questions I got on those ones. If you do not have access to medical masks, what's the alternatives? Can they just make masks at home, or what are the suggestions you have for them?
Yes. So CDC has recommended wearing face protection when you go into a pharmacy or a grocery store. And if you don't have access to masks, which you know, is common right now with the shortage of the PPE, there are ways you can use a scarf, or you can use a bandana, anything that has multiple layers to protect you from transmitting the virus to others. That's the whole concept, is if everybody does that, asymptomatic shedding can stop, and hopefully the virus curve that we're bracing up for can flatten. So, you know, anything you can use at home. I've seen people be very smart and try to make these masks at home, as long as they have multiple layers of clothing in the mask surface. That should be able to help. If you have a single layer, I don't know how much that would help. It depends on the cloth that you're using, but you can make masks at home, yes.
Fantastic. Well, I think, you know, this question's coming in, but, you know, in the interest of time here, and also I'm not quite sure, this first time we're doing the virtual event here, so I'm not sure if it's going to kick us out after an hour and a half. So what I'm going to do is I'm going to just unmute everyone. If you guys can, you know, give Mr. Dr. Duggal a big round of applause.
All right, Anurag.
Session.
That was awesome information.
Good job.
Thank you.
Reserve misses you.
Misses you. Thank you, Anurag. This is Kiran.
Thank you.
Here.
Thank you.
Nice job.
Thank you.
Go Browns.
Thank you.
Thank you.
Thanks, Anurag.
Hey, thank you.
I know everybody
Just can
here,
stay
so,
for one more minute.
you know,
If you guys stay for one more minute, just wanted to.
if you let me just say one more thing. If you have any specific questions, you can reach out to me. You have my number. You can reach out to me on Facebook as well. But you know, the key is we're not through this yet. We are only we are not even at the peak yet. So we need to do what we're doing and keep doing this for some time. Please do this for some time and stop the spread of the virus. Stay at home, maintain social distancing, wash your hands, do everything that you're required to do. And hopefully we can get out of this quickly.
And how do we share this, you know, with our friends?
That's a good question. So what we're going to do is we're going to be sending the recording of this to all the registered users at Startup Grind. So if you haven't registered, go to startupgrind.com/FRISCO, and all it requires is your email address, and we will send it out to you. You can share it with us. All right. All right, and then again, this event has never been possible without our sponsors. Comerica Bank, thank you so much for helping us from the day one. And we have partners like UC Mass, VentureX, Massage Lux, and Lifestyle FRISCO and Acme Tech Global Solutions. Thank you all for making this happen. And we will be doing more of these virtual events. It's the first time, so I apologize for all the technical difficulties we had at the beginning of the session. And I'm sure we're going to get better at this. We're doing more of these events in the future. We're going to bring more events, so just stay connected with us at startupgrind.com/FRISCO. Thank you, everyone, for joining this call. I hope you had your questions answered, and stay safe and stay healthy. Thank you, Anurag.
Thank you, Ramesh, for organizing this.
Yeah,
Thank you.
thank you, Anurag. Thank you, Ramesh.
Thank you, Anurag.
Take care.
All right.
Thanks, Anurag.
All right.
Stop.
Thank you.